Hi, thank you for watching Digging to China. I'm Dong Xiong. If you have not done so already, please subscribe to my channel. Thank you very much. After 3 years of relentless mass testing and lockdowns to defeat an invisible enemy, China suddenly relaxed its zero-COVID policies last Wednesday to join the rest of the world in living with the coronavirus. Last Wednesday, Beijing said that it would stop reporting asymptomatic COVID-19 cases. Why? Because mass testing is no longer required. It has become impossible to track case numbers. A notice on the National Health Commission's website said it has stopped publishing daily figures on asymptomatic COVID-19 cases since it was impossible to accurately grasp the number of those infections. In the past, asymptomatic COVID-19 cases have generally accounted for the vast majority of new cases. The only numbers the Commission is reporting are confirmed cases detected in public testing facilities where symptoms are displayed. Many people also test at home, and any positive results there would also not be captured. The announcement came as a relief for hundreds and millions of people whose lives and livelihood have been largely upended since the pandemic started. Meanwhile, China has begun to see what appears to be a rapid increase in new infections, raising concerns that its health system could be overwhelmed. So far, many of those newly sick are staying home, and there has been little evidence of a surge in patient numbers. But it's difficult to get a clear picture of the spread, and the new reporting rules could make that even harder. Some hospitals have reportedly struggled to remain staffed because of rising infections among employees. China's government-supplied figures have not been independently verified, and it is reasonable to question about whether the ruling Communist Party has sought to minimize numbers of cases and deaths. While many Chinese people greeted the relaxing of the pandemic rules with relief, it also caused some concern after years in which the Chinese government talked about the virus as a major threat. Despite the easing, the streets of many major Chinese cities have grown eerily quiet as many people stay home, not because they have to due to the lockdowns, but because they are worried about contracting the virus. In many cities, entering restaurants and some other public venues still require negative test result. Many Chinese are choosing to forego such pleasures to avoid testing, leaving many establishments shuttered or empty. In Beijing, the usually bustling streets around the ancient Imperial Palace complex are empty. By contrast, lines have formed outside some fever clinics in Beijing. Pharmacies in Beijing are rationing out medicine and other supplies. Rapid antigen tests are sold out across the city and online. Domestic media reported that many symptomatic medicines to treat fevers, cough, and colds had been sold out in many pharmacies across the country. Some metropolises, including Guangzhou, Beijing, and Shanghai, had also run out of the N95 masks that are believed to offer better protection against the Omicron strains than regular surgical masks. Some have taken to ordering from pharmacies in Hong Kong, which has been relaxing its restrictions without the chaos and uncertainty seen on the mainland. Like much of the world, Hong Kong uses mRNA vaccines that are widely considered more effective than those mandated by China. Many Chinese are trying to protect themselves by using unproven remedies, a trend seen from India to the United States amid soaring cases in the past years. Over the past few days, social media has been flooded with people sharing posts about their infections and recovery diaries, most in the capital city, Beijing. Canned peaches, which are rich in vitamin C, and electrolyte water have emerged as the most popular items to fly off the shelves. People are hoarding them in the hope of preventing infection from COVID-19. While online posts tout their health benefits, there is no scientific data backing up the claims that they can prevent people from getting COVID. China's leading online grocer Hema Shengsheng saw a sharp rise in demand for canned peaches starting Thursday. By Friday, the fruit, which has a longer shelf life, was sold out at Shanghai's Hema stores, with other supermarkets such as Aldi and Carrefour also reporting higher demand for the item over the weekend. 23-year-old Liu Chen, a Shanghai resident, summed up what many Chinese people share. It's a tradition that whenever we get sick, we eat canned peaches. The cans may keep us away from sickness. The pronunciation of peach sounds similar to that of escape. The god of canned peaches will bless every child, he said. Responding to the medicine shortage in Beijing, the deputy director of the city's drug administration said that the municipal government was working to deploy additional resources, encourage factories to expand the production, and crack down on price gouging. Authorities have also pleaded with people to stop hoarding medicines and refrain from self-medication or using unproved treatments. Apart from canned peaches, many people were also hoarding electrolyte water. Between last Wednesday and Thursday, demand for electrolyte water skyrocketed by 2,000% on the e-commerce platform JD.com. The Chinese Center for Disease Control and Prevention had recommended drinking water with a certain amount of electrolytes in its COVID prevention guidance published in 2020. On lifestyle platform Xiaohongshu, tens of thousands of people have also been discussing how to secure certain medicines from smaller cities and villages, where the surge of the outbreak hasn't been as big as in bigger metropolises. Many say they were anxious about not being able to stock up on essential medicines, but were met with criticism instead. Please, those from urban places, don't be drug scalpers. Don't compete for medical resources with us, said a user on Weibo, referring to the discussions on Xiaohongshu. Give those of us from underdeveloped places a chance to live, he said. Last Tuesday, the healthcare platform One Pharmacy began selling Pfizer's oral COVID treatment pill Paxlovid. The price? 2,980 yuan, about $430 per box. This drug is currently not covered under the National Health Insurance Scheme. The drug reportedly sold out in 1 hour. Next 2 months will be a very tough time. My best wishes to Chinese people. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly. Until then, be well.